Hello, this is Dr. Arthur Nita of Anchor-Based Spine Center. With Scoliosis Awareness in June, we're going to talk about some things to look for, some statistics, and a at-home test you can perform at home on you or your child. So scoliosis affects 1 to 3% of the population. Okay, it's a curvature of the spine with usually a rotary component where there's some rotation, and also what we find out, it is 10 times more likely to progress to the rehab bracing school and surgery level, 10 times more likely in females than males. Okay, so what to look for when you're at home with your child or whoever? Make sure the shoulders are even, hips are, the pant line is even, square. You want to make sure the knees are even, are going straight out, and same with the feet. With the feet, it can have a little bit of variety, just a little bit of variety too, also. But one of the big take-home tests is it's called the Adams bending test. Put your hands together, you bend down to touch your toes, like your fingers to touch your toes, and you want to make sure the back is even. What you don't want to see is kind of like this. You don't want to see that or this. You want to make sure the back is even. Okay, so you want to kind of put your hands on the back. You don't want to make sure one rib arch or rib hump is higher than the other. Okay, so look for those telltale signs. This is specifically important for females between the 10 to 13 age range. Anytime when there's a growth spurt or the start of their menses cycle, or for boys, you want to be around that. Really, the progression is at this highest between that 14 through 17 year age range. Okay, again, this is usually when puberty starts, is in those respective age groups, or those at the beginning of those ages. So really pay attention to that, and check once a month, especially during growth spurts or around the puberty age. Okay, if you have any questions